In this lesson, we are going to read through the Managing Personal Hygiene and Health topic in the Template Food Control Plan. This is one of the blue-colored cards in the starting section of the plan and is page number 36. What do you need to know? Personal hygiene and health is important because it helps prevent contamination of food, making it unsafe and unsuitable. Ways to protect food from contamination from people include washing hands, not working with food when sick with anything that causes vomiting, diarrhea or jaundice, wearing clean clothes, for example, aprons, hats and hairnets. Washing your hands helps to keep bugs out of the food preparation area. Regular hand washing helps prevent contamination of your food. Sanitizer can be applied after hands have been thoroughly washed with soapy water and dried. Sanitizer cannot be used as a replacement for hand washing. You and your staff should seek medical advice if you or they have jaundice, or have vomited or had diarrhea 2 or more times in a day, or have been sick with a tummy bug for more than 24 hours. Staff who have had a tummy bug should not work with food until 48 hours after their symptoms, such as vomiting and/or diarrhea, have stopped. If staff contaminate food due to sickness or poor hygiene, you may have to throw it out, or you may have to recall it. See the Recalling Your Food card. Why is personal hygiene important? One of the most common ways bugs get into food is from people, mostly from their hands. Regularly washing hands with soap and water for 20 seconds, rinsing, and then drying them properly, using paper towels, single-use cloths, or an air dryer, is one of the best and easiest ways to help prevent bugs getting into your food. Uncovered cuts, sores and boils can spread bugs and make food unsafe and unsuitable, especially if they are weeping or infected. People who wear gloves, whether to cover plasters, sores, or for preference when handling food, need to change their gloves after touching something other than food, such as their nose or a rubbish bin lid, and wash their hands whenever they take dirty gloves off, and before they put clean gloves on. Harmful bugs can be transferred to food through a sick person's feces, vomit and other body fluids, such as blood and snot. Dirty clothing can contaminate food, surfaces and equipment. What do you need to do? Wash your hands in soapy water for 20 seconds, then dry thoroughly using paper towels, single-use cloths, or an air dryer. Always have soap and paper towels, single-use cloths, or an air dryer by the hand washing sink. You must keep your hand washing area clean. You and your staff must wash your hands when entering the food preparation areas, before handling food, between handling raw and cooked foods, between handling foods that contain allergens and foods that do not contain allergens, between handling cleaning products or chemicals and food, after coughing or sneezing, after using the toilet, after using your phone, after taking out rubbish, after touching something you think is dirty. Complete your plan by ticking the choice that you and your staff must do to manage any cuts, sores or boils. Completely covering any cuts, sores or boils. Not handling food if cuts, sores or boils are weeping or infected and cannot be completely covered. Gloves must be changed after touching something other than food and between touching raw and cooked ingredients or meals. Hands must be washed whenever dirty gloves are taken off and before clean gloves are put on. Managing staff who are sick. You or your staff must not work with food when sick with an illness that can be passed on through food. Any staff or visitors who have vomited, had diarrhea, or have had jaundice in the 48 hours before entering your business, or who develop these symptoms when on your premises, must immediately tell either the day-to-day manager or the delegated persons. Complete your plan by ticking the appropriate choice and, if a delegated person, confirm their name and/or position. Staff must stay away from the food-making area until 48 hours after symptoms have stopped. Staff that are sick may be able to complete tasks that do not involve them entering food preparation areas or coming into direct contact with food. Wear clean clothing when handling and preparing food. Clean clothing, for example, aprons, hats and hairnets, must be worn before handling food or entering food preparation areas. This applies to visitors too. You must ensure that staff either wear their own clean clothing or wear clean clothing that the business supplies. You must complete your plan by confirming which choice. Remove outer protective clothing such as aprons before leaving the food-making area, for example, to go to the toilet or to go outside, and so on. What do you need to show? Your verifier will wash their hands when they enter your business to check that everything they need to wash their hands is there. Your verifier will ask, who is responsible for making sure your hand-washing area is fully stocked and cleaned? How you know people are washing their hands when they should. They will ask staff about when they wash their hands and may ask them to show how they wash their hands. They will ask what happens if someone has a tummy bug or gets sick. The verifier will check that everyone who handles food puts on clean clothing or aprons at the start of, or as required, during each shift. They will ask how you make sure clean clothing is worn. They will ask questions about your rules around clean clothing or any issues you have had with your rules. Show your verifier a written record of when staff were sick.